Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and we're going to talk some more about orthodontics. And I have a real interesting subject here. This young lady, we're correcting a functional defect in the facial structure, and this is something I don't expect people looking at this would want to get into this involved orthodontics, but you could prevent your child or anybody you know from having to do this if you could correct some simple things like thumb sucking, mouth breathing, and all sort of allergies and things that people have. You can have them treated for these things so that they can breathe properly and swallow properly. You swallow somewhere around a couple thousand times a day, and you bite your teeth together, and if it's done right, you bite your teeth together. If you don't, you're swallowing without biting them. This is an infantile swallow pattern, and your teeth are not pressed together 2,000 times during the 24-hour. Now, I didn't count anybody, but that's what they tell me, that people swallow about that much during the 24-hour period, and that's you're pressing together with a certain amount of pound force, and that keeps the teeth from over erupting. If the teeth over erupt, this space between the nose and the bottom of the chin gets out like that, and it looks bad, and it really takes away from the appearance of the person, whether they're male or female. A lot of times males can get by with it, but a young lady really needs to have this corrected. And if you can't correct this, the facial structure will grow wrong. And I want to show you how you could stop this if you could get to a person or and you can really stay with them and get them. Now you may have to take them to somebody and have them treated for allergies. Allergies are really messing up a lot of people in this country, and I'm sure in other countries that are more pollution in the air than here, and they'll have just as much or more of defects come about. And I'll talk to them when we get to each one of these. Now here is the young lady, and this is what she looks like. It doesn't look all that terribly long down here, but when you look at the face, it's kind of drawn out in the vertical direction, and this is greater than we want it to be. Now, she breathes wrong, and when you breathe through your mouth, you tended to swallow with just keeping your lips, kind of suck your lips in, and you can swallow without biting your teeth together. But if you think that's funny, just try swallowing without biting your teeth, and most of you won't be able to do it, but I've done it so much showing people that you can kind of put your tongue in there and you can swallow without biting. But you bite together around 2,000 times a day. I mean, these teeth are going down here, and they hit these, and that's where the problem works out itself. I mean, these teeth here are set to erupt into the mouth, and these are set to erupt in the mouth and come in contact with each other, and that's the way we were made. And so if you're swallowing correctly and you bite these together a couple of thousand times during the day, this determines the vertical height of the lower third of the face and how the person looks. And so we're going to have to go through I tried everything in the book that I could think of to get this down, and I couldn't do it, so we had to send her in for surgery, and you can see the difference in there. This is the expensive surgical procedure. It could have been stopped, or could have been corrected on its own, and if we knew this. So people looking at this, you're not going to do all this, but you will learn something about how what makes it happen, and maybe you can stop your child or yourself or other people from having this kind of problem. Now, we tried everything in the book to get this together. I put a headgear in here that actually pulls straight up, and it works on the teeth. It tends to raise the teeth, but it didn't do it. I put a chin cup down here, and we pulled it back and up and tried to get the reduction in the height of his face, this part right in here, get it pushed down, and we couldn't do it. We took out her 6-year molars, which is a good thing to do if you want to lower the vertical height of the face. You can take the 6-year molars out, and then you can lower it some before the second and third molars get in very far. Sometimes you can catch one early enough, and you can do that and then stop them from breathing through the mouth, have them treated for allergies, and you can have other bad habits broken to help do that. I tried everything I could do to get that down, but I could not reduce it down. Now here is the way the model looks. Now, when you see a model, it looks kind of like an arrowhead in here. You know that person is not swallowing correctly, or the model would be out like this, like the tongue down here. Now the tongue stayed in the bottom arch. There's no way, if you're breathing through your mouth, your tongue has got to be down here in the bottom arch. And so it gets a little bigger. And I'm a mouth breather, not terribly, but my bottom teeth stick out further than they should, and so I hit cusp to cusp, and I bite my cheeks. And that's what happens when your bottom arch grows out and it gets pushed out there by the tongue. And if you think your tongue won't shove your teeth around, you're sadly mistaken. It will shove the teeth or anything. Now, she sucks back when she swallows, so that she swallows with an infantile swallow pattern. You watch my lip. If I do that, I'll pull the lip back, and so these teeth, they move back and these move out. And that happens when you're breathing wrong. Now, we came in and I said, excuse me, we're going to take these teeth out, and that helps. And then you can get more force on these molar teeth before these start in. And she's got wisdom teeth, and we'll end up using the wisdom teeth. You see, we're going to close these up, and this tooth here will be over in this area right here. And you can, if you can correct the function, that's the bad boy that's causing the problem in here. Now, we had to go in, and I didn't do this surgery, but it was a horseshoe type surgery. You come in and you cut down through the top, and you put your finger under here, and when you get close to it, you stop when you get through the bone and leave the tissue. And this part of the palate you leave down here, and you raise the other part of the palate up like this, and that reduces the height of the face. It leaves as much airway as you can get in here, and you can see this on the model after the surgery if you look at it. And then I had to close all this space up in here, and we use the wisdom teeth. So if you're just beginning in orthodontics, don't even think about doing a case like this. You need to have a lot of it under your belt before you want to start doing something like this. Now here she is after the operation, and you see the facial structure is reduced quite a bit, and this is the models with her teeth right out in here. And if you remember to start with, her models were protruding the upper teeth were protruding out past the lower teeth quite a bit, and the lower teeth were crowded underneath there. And here is the facial picture after the operation. He got this down like that, and here the teeth are over here, and the 6-year molars are gone, and you don't even know they're gone. And this is why we have talked to people about leave your wisdom teeth alone if they're not really bothering the person. Don't jump in there. I know some dentists that just say, well, take out the wisdom teeth. They don't even think about it. They don't even know why they took them out. Wisdom teeth have a kind of a bad press, and they get removed a lot of times. They're some of the best teeth you've got in your mouth. They chew right underneath the muscle, and you can bite on the wisdom teeth and the second molar harder than you can on anything else in the mouth. So leave them alone. And if you take the 6-year molars out, and some of them, the kids don't brush good when they're young, and their 6-year molars go bad, and you have to have root canals and crowns and just unlimited expense. If you go have one root canal done on a molar tooth and extract it or take it out, or if you leave it in and you crown it, you've got a tremendous amount of money that goes out. If you can take those teeth out, you can, and you're doing orthodontics anyway, we can slide the teeth up from the back. But you start sliding them up immediately when you take the teeth out. And you can close that gap in so just a few months. You can close it up and have the roots up there too. We show videos showing how to do that. Now, this is after the surgery. Now, this is what the palate looks like, the roof of the mouth up here. Look how this is. It looks like an arrowhead in here. Look at this. Now, so you've got it shaped like the tongue. If you look here close, you can see where the surgical, they went in above the maxilla and above the roots and went in and cut this down, and the surgeon has to put his finger down in here, and when he feels that burr getting close, get away from it. I wouldn't want to be sticking my finger in there anyway, but you can feel it quite a bit before it comes through the tissue. And you leave the tissue alone, and then you take this portion of the teeth and go up with it. This goes up. I can't draw that on here properly, but that goes up, and that lowers the vertical dimension of the face in here, but you can see how it's grown. Now, at this time, we can widen the mouth any mouth you want to. This is the same mouth as that is. Here it is with the functional problems. You can see it. You can see your own kids and kids that you know. And if you can stop them from breathing through their mouth, take them to an allergist or somebody, or an ENT person, and make sure they have figured out. I mean, if they're sitting around with their mouth open all the time, and I have a trouble with it like that, have something done. If you have to take out reduce the turbinates, or a deviated septum or something, or polyps or growth, whatever's stopping up the airway, have that corrected. Now, and you can see right here, look at the difference in this mouth and over here. I mean, there is a world of difference. This is not the mouth being big that you want, but you want the airway up above. And the airway in this tooth, in this model, is much less. If you bring the maxilla together, that's where your airway is, and there you reduce the airway. So we have widened the airway out. And when you spread the upper teeth out, always move the roots out with a little buccal root torque, and have something that'll bring it out. And so you increase the airway in here. If you could get the airway big enough till the tissue swelling up doesn't stop your breathing through there, that's really good. You don't have to worry about getting it too big. I don't think there's any danger you're doing that. But try to root the roots out by putting buccal root torque in the upper teeth. So as you spread your lower teeth out, like if I bring these teeth out to here, I'm going to have to bring the roots out, you see. They're going to have to come out, and the back teeth also. All right. I've got problems myself here, and I'm telling you how to do it. Now, when we spread this out and everything, we made plenty of room. In other words, it went out down in here in this way. Now, the lower arch was widened by the tongue back here, but it didn't widen it up in the front, and that's normal. I mean, your tongue, when you push out and swallow, it'll spread out across here, but you get very little pressure up here, and so this is narrow right down in here, and it's plenty wide back there. So these are things, if you look at your children or your neighbors or your grandchildren or even adults, they can change these things for you. Let's go now to another picture. Here is the picture after they did the surgery, and you get this distance and here to here, and there's a lot of difference in it. And this lengthening of the face here, pulling down on the nose and the tissue. You see she's got a little cheek up here. If you bring this up, this would fill out, and the person will be a lot prettier, better looking. It doesn't matter whether a man or a woman. Women would care more for it than men, but men want to look good also. And you can see a world of difference in that. Now, if you look at it from the front, this coming across here and coming across here, you know, the distance in here, it also pulls the face down this way. The maxilla is narrow, the face is more narrow. Now the face is rounded out. She's got loose tissue up here that makes a beautiful little dimple-like facial structure. It changes the facial structure of this person tremendously, just correcting the function that is going on over here. And I tried every way I could to get it down, but I could not stop it, and I sent her to surgery, and this is what we got. But the surgery is tremendous, and you don't want to do it unless you just really have to. And I think that kind of finishes up what I wanted to say in this video. If you're doing orthodontics and you're just starting, stay away from this type of case, you know. But if you really know what you're doing, the surgeons like to work with you. I had 6 or 8, maybe 10 surgeons that I did orthodontic surgery with. I tried to do as little as I could, but I had several, I mean a good many patients. Some of the surgeons would come to the office and we'd bring the patient in and they'd work it up there. And I met some of them at the hospital, and we worked on one lady from 7 in the morning till 1 o'clock that day. And we shortened her maxilla, lengthened her jaw, changed the chin button, everything. Just don't get into the surgery if you can help it. It is the guy put the maxilla up there and asked me how it looked, and I told him, I said, man, don't ask me. I don't know. Thank God that the Creator's going to put it back together again, and he did, and the lady really looked better, and her children didn't even know her when she came home. He saw her for about 2 or 3 weeks after the surgery. Thanks for watching, and I hope you will get something from this that you can prevent the surgery from happening. That's what you want to do, is get people breathing and have them breathe through the nose, not the mouth. And you see the lip, goes up like that. And you have to pull it hard to get it together. So I hope you come out, and I'm going to say goodbye, and I hope to see you again, and join our group and subscribe to it. Like to have you come in there. I'm going to close out now.